This video will help you act as a good steward for the finite clinical resources we have to work with. The scenarios you're about to see between a doctor and a patient show you how to follow a simple 5-step approach to gain the patient's confidence and cooperation with your plan of care. First, clarify what your patient's true concerns are. Don't assume you know what they are. The patient may have misconceptions that need to be rectified. Next, provide the patient with the information that he or she needs to understand why you're recommending your plan of care. Be sure to be courteous and respectful. Tell the patient what to expect and look for, and what to do if things don't go as expected. Make sure the patient is satisfied with the plan of care. If not, go over the previous 4 points again. Following these 5 easy steps will allow you to enlist your patients as partners in providing the best quality of care and also making the best use of finite clinical resources. Great, lungs sound nice and clear. Basically what you have is a viral upper respiratory infection and really can't treat anything but the symptoms. So keep doing what you've been doing,
I have the same symptoms as my wife and my kid, and they received antibiotics. Will I get some?
Well, no, I don't think they really are going to be useful for you, because antibiotics really only work against the bacterial infection, and you just have a viral infection. So the antibiotics really won't help at all.
Now that explains why they didn't get better right away.
Yeah, no, that's exactly right. Whether we give them or not, the course is usually 3 or 4 or 5 days and then get better. And antibiotics have their own problems as well. If we use them now when they won't help, when we really want to use them, they may not work at all. And they have their own side effects. You can get rashes and diarrhea and stomach pains and even sometimes very serious side effects from them as well. And again, they just won't work for you at this point. So just keep doing what you're doing. Take it easy, rest, suck on some cough drops for the sore throat. Now, if things get worse, if you get shortness of breath or any chest pain, a high fever, then let me know and we'll reevaluate it at that time. Okay. Sound all right?
That sounds great.
Great. Okay, good.
Thank you.
Okay, good. Well, everything seems to be pretty good. No serious signs of anything going on with your back other than the sprain that you have. So what I want you to do is keep doing what you've been doing, taking the pain relievers around the clock. Avoid injuring your back again. Don't bend over or lift anything heavy.
Now, does it mean that I'm not going to have an X-ray or MRI? My brother injured his back in a similar manner, and he got an X-ray.
Mm-hmm. Well, I don't think we really need one at this point in time, because usually the kind of injury you have will get better in the first 6 weeks or so, and really nothing to be gained from doing the MRI.
Okay, but my back really is hurting. That wouldn't really help, or?
No, it really wouldn't help at all. The only reason we would get an MRI is if you weren't doing well and we were contemplating doing surgery or something.
No, I don't want surgery.
Okay, yeah, I don't think you need surgery either, and that would really be the only reason we would get the MRI at this point. So just keep doing what you're doing. Okay. Take it easy, don't do things too strenuously, but try to exercise every day. Okay. Take those pain relievers around the clock, and that will help the pain and the inflammation. Okay. And you should gradually get better over the next, may take weeks, 3 or 4 weeks or so. Okay. Now, if things aren't getting better and 6 weeks go by or things get worse, then definitely, let me know, and then we'll reevaluate whether we need to go ahead and get that X-ray.
Okay.
Does that sound good?
Sounds good.
Excellent. Okay, great. Okay, well, everything seems to be really good here with Faith. She bumped her head, but I don't see anything very serious going on, so I think we can just go ahead and observe her, and everything should be fine.
Okay. You don't think we should get any x-rays or anything like that?
No, I don't think so. She fell yesterday. It was only from a couple of stairs. So it wasn't really from a high place. She didn't lose any consciousness. She hasn't had a headache. She hasn't been vomiting. She looks great. So, no, I don't think we need to do that.
Okay, I just always heard so many stories, and I would really, really like for her to get some type of x-ray or something just to make sure.
Sure, I can understand your concerns, but we are almost 100% sure. And x-rays themselves actually do carry some risk. It's a fairly high dose of radiation, and that can even increase the chances of brain tumors later on.
No, we wouldn't want that. Okay.
No. So why don't you just watch her? If she develops any kind of a headache or worsening headache, develops any vomiting, starts getting sleepy or spacey, well then you contact me and we'll go ahead and we will get x-rays then. But right now I think you're doing just great.
All right, that's good.
Super.
Thanks.